What about the esophageal stages? The esophagus is a food tube or a food pipe. The esophageal stages of swallow are managed through gastroenterology. As a speech pathologist, our training is to maybe observe what's happening in the esophageal stages, but defer to our colleagues, our specialists, physicians. The esophageal stages sometimes, though, impact our pharynx or our throat. If we have a patient who has had radiation in the field of the pharynx or the pharyngeal region, that may impact those muscles and extend into what we consider the upper esophageal sphincter or proximal esophagus. Sometimes, if the proximal esophagus or upper esophageal sphincter doesn't open wide enough or remain open long enough for food to pass into the esophagus, we get a backflow of food or liquid into the pharynx. So our patient completes their swallowing and then they feel like it's sticking at the level of the esophagus. If it's sticking at that level, we look to see what's actually happening. We do not have X-ray vision. We need swallow studies to help diagnose what our patient is experiencing. The speech pathologist works in collaborative care with the gastroenterologist in these cases to see who can do what to be able to help improve the quality of life of our patient. An esophageal dysphagia alone is managed by gastroenterology. A pharyngoesophageal dysphagia is managed by combined speech pathology and gastroenterology. It's important to determine what your patient is experiencing prior to starting treatment. That's what we do at Wildflower Therapy. We help to evaluate the swallowing and work with our physicians and our team to determine what are the next steps for our patient to improve their road to recovery and rehabilitation.